What affirming language should be used in transgender youth health care? Imagine walking into a clinic where every word makes you feel seen and respected. That's the power of affirming language in healthcare for transgender adolescents. Using the right words can build trust and support their journey. First, always use the youth's chosen name and pronouns. If you're unsure, politely ask and then consistently use what they prefer. This simple step shows respect and helps reduce distress. Next, use gender-neutral terms when talking about body parts or roles. Instead of saying breasts, say chest if that's their preference. Instead of assuming relationships, say partner unless they specify otherwise. Affirming language also means explicitly validating their gender identity. Say things like your gender identity is valid or we support you in your gender journey. Avoid language that questions or doubts their identity. It's important to never misgender or deadname them. Using their current name and correct pronouns is essential to avoid emotional harm. Some youth prefer identity-first language, like transgender youth, while others prefer person-first, like youth who are transgender. Always ask and respect their choice. Recognize that each young person's experience is unique. Use phrases like, there are many ways to express gender to normalize diversity. Use supportive language that avoids framing transgender identity as a disorder. Instead of suffering from gender dysphoria, say experiencing gender dysphoria or seeking gender-affirming care. Consistency is key. Use affirming language throughout every part of care, from appointment scheduling to follow-up notes. Intake forms should include options beyond male and female, with space for chosen names and pronouns. When working with families, use language that supports the youth's identity and explains why affirmation is important for mental health. For example, tell parents that respecting their child's gender identity can improve their overall well-being. In healthcare settings, introduce yourself with your own pronouns and ask the youth for theirs. Use inclusive language on forms and in conversations. Train all staff members to use affirming language and practices. When discussing medical options like hormone therapy, use respectful terms such as gender-affirming hormone therapy. Always validate the youth's choices and emphasize that care is tailored to their needs. By consistently using affirming language, healthcare providers can help improve mental health, reduce barriers to care, and create a safe space for transgender adolescents to thrive.